this is Dana Brigman of the Canine Coach Carolinas, and this is episode 2 of our new podcast series. And I have today with me Judy Ray from Texas, who is going to be talking to us about one of her dogs. She has multiple stories that I wish she could tell all of them, but she's going to be talking to us today about your Boston Terrier. Is his name Pocket?
His name is Pocket, yes.
Pocket. And he is one that she's been working on with a parathyroid tumor. And I'm just going to let her take it away and tell this story and her journey into wellness and health for this little guy.
Okay. Hello, everyone. I am thrilled to be here today to share this story with you. Pocket was a 10-year-old Boston Terrier that I pet sat, and they would bring him to the house and drop him off with me. And I noticed that he was having some muscle fasciculations when he was sitting in my lap. That's where involuntary muscle jerks. And then the owner was telling me that they were having some issues with him at the house because of his behavior. He was kind of grouchy and snapping at the children, and that was, totally unlike him. So I asked him, I said, I'll be willing to adopt him, and he's more than welcome to join my herd. And so they thought about it, and they said, yes, I think that would be the best thing for him. Well, the day after he came to live with me, he vomited. So I took him in for some lab work, and it revealed he had a calcium that was greater than 16. Normal is 7.9 to 12. So that answered the questions of where the muscle fasciculations were coming from and his behavior. He had loss of appetite. He was lethargic. He wasn't Pocket that the other owners knew, and I knew too also.
Judy, how long? I'm sorry, I told you I'd have questions. How long had this been sort of building up to this point in time with these muscle issues and whatnot before you got him?
Yeah, I don't know. The owners weren't sure. They didn't really notice the muscle fasciculations in him very often.
Okay.
And so that was kind of news to them, that was going on.
Mm-hmm.
So and he was 10 at the time.
Gotcha.
So that was 3 years ago. So I took him in, and we did an ultrasound on his throat, and sure enough, he had a tumor on his parathyroid that was causing his calcium to elevate. Now, the treatment for that is surgery. And what I didn't like about that is on the table, with the sudden loss of his calcium, he could seizure. They could lose him on the table. He was going to have to stay in the hospital for 2 days till they regulated his calcium. That's something that we would have to keep a very close eye on for the rest of his life. And at any time, we could lose him, even after the surgery, and we brought him home. So I really didn't like those odds. So I brought him home, and I worked closely with Dr. Lori Miller. She's actually an equine vet, but she's a vet. You know how that goes.
Well,
so,
all you people in Texas have all those horses, but I wish I could come play.
Oh goodness! So I got a hold of her, and she goes, "Oh no," she said, "We got this." So I started doing the Ecuadorian protocol, and the Ecuadorian protocol, and it has to be mixed in this order. It's Palo Santo, 7 drops, lavender, 7 drops, frankincense, 7 drops, 1 drop of peppermint, and about 5 mLs of carrier oil. And you give that per rectum once a day.
Did you make it suppository or just an insertion of the fluid there? How'd you do that?
There's a special syringe that has a tip on it, and it's a white tip. And the way that the plunger is made is that plastic comes into contact with the oils instead of the rubber grommet. Mm-hmm. The rubber grommet is actually around the side, and the plastic is on top.
Gotcha.
If anybody needs any of those, I can certainly help them acquire them.
Awesome.
So he was getting that. He also, what I did, one of the first things I did was change his diet. Mm-hmm. He was on a kibble, And I changed his diet to a raw. And I started out with the Origins, but that caused his calcium to go up because there's a lot of calcium supplements in those foods. So, and then I did a detox on his throat with clove over the parathyroid gland, and it caused a major detox. So I was excited about that.
And so what, I'm sorry, but I'm wanting, because I know a lot of the people that'll be listening and watching this won't have any experience like you do, but what did you see that told you it was detoxing?
He started breaking out in little tiny red spots on his throat. And that told me that, it was kind of breaking up in there and that things were happening.
Because a lot of people would panic at the little spots that we're seeing on the screen here and go, oh my God.
Right.
Stop everything. I mean, they would put the brakes on, right? And
exactly. So
yay
about this, Exactly. It's like, yes. So between, changing his food and doing the clove on top topically, and then giving him the Ecuadorian protocol, he was starting to kind of, it was like take 2 steps forward, fall back 1.5. Mm-hmm. But I felt confident in what we were doing. And also I used heligrism because there's nothing in Western medicine that binds calcium. You have medications that will bind phosphorus for kidney issues, but you don't have anything per se that has been proven to bind calcium. So it was like, what would do that? So we kind of tried a few things, but the heligrism seemed to be doing the best. Awesome. So I would give him 9 to 10 drops of heligrism the same way as I did the Ecuadorian protocol for rectum. And so I would give him, another dose in a couple hours if it didn't bring down the muscle peticulations. Because there's a lot to worry about with high calcium.
Sure.
You develop stones in the bladder, calcium stones. You're going to, just the sheer pressure on his heart is bad. And so we played with that a little bit. This is not an exact science, that's for darn sure. Mm-hmm. So he would, and I could tell when he didn't eat, that his calcium was high, even though without muscle peticulations. He loved this plant outside in my backyard. I know the people on the podcast are not going to be able to see it, but there's a plant. It's actually a weed. And when I presented this at Candace's Animals and Oils, a lady came up and she said, I don't remember the name of it, but she said it's very high in antioxidants.
Interesting.
So he would go out there and graze on that weed. And I was like, wow, they really do know how to, what they need. And of course I use absolutely no chemicals in my yard. So it was perfectly safe for him to munch on it.
Right. Were you seeing any other symptoms from him? I know you mentioned like lethargy and grouchy and the muscle tremors and that sort of thing. Was there, did he have a loss of appetite or anything like that?
He would when his calcium was real high. Okay. And when his calcium was real high, he became nauseated. And he would vomit. He was lethargic, didn't want to eat. So I knew I had to, give him some more heligrism and get that calcium out of there. And a lot of times I would give him sub-Q fluids to help flush the calcium out after I gave him the heligrism. Luckily, I'm able to do that at home. And I would, load him up on 200 milliliters. And then he would, between that and the heligrism, it would just kind of flush his system out really well and his calcium would come down.
And I apologize if you're going to get to this in your presentation, but in his diet, did you reduce the amount of calcium that he was taking in through food, or was there any consideration about the specific makeup of his diet?
He got raw. He got
Right.
organic.
Raw,
A
a lot of people in the raw will include, the bone, the whole animal. Is that what you were feeding, the bone and all, or were you on a different approach?
Just the muscle.
Gotcha.
Just the muscle. And I would add, of course, Ninja Red.
Okay.
And I added, multigreens, sulfazyme, super bees,
Mm-hmm.
and he got his omega G's for his fish.
Mm-hmm.
And he did really well on that. He did really well. And sometimes, it's good to switch your protein source when you're feeding raw. So he would go from, organic bison to organic chicken, or he would go to organic steak. He's a Boston Terrier, so he was raised on steak in Boston because he was a gentleman's dog. So he got steak. I would feed him that, and I would alternate, back and forth. So he would board and everything. And we got his calcium down, very to 12.3 in May of 2017, and it's even lower now. It bounces around between 9, 8.5, and 9, which is happy for me.
Right.
And see, get all that. And then for exercise, it's just as important for them to stay mentally up. And so he would go for walks, and then I learned he loved to play ball. And I also noticed the more exercise I gave him, of course, it would help bring down his calcium because he was moving and drinking, and everything was just moving a little bit better with the exercise. So I kept him very active, very, very, very active.
Okay. He looks happy in this photo.
He is doing great now. He's had his teeth cleaned twice because his blood work is excellent.
Awesome.
And he was 10, so he's 13 now. He'll actually be 14 in August.
Mm-hmm. Little cutie.
He is adorable. He rules the roost. Mm-hmm. And that's him.
Mm. She's showing a picture of him with the ball in his mouth, running and playing. So he's 13 now, you said, and he's doing well. He's healthy.
Yes, he's doing great. He's doing great. I really, in all of my 25 years in veterinary medicine, I never had the opportunity to run across a dog with a parathyroid tumor. He was my first.
Mm-hmm.
I was talking to a veterinary clinic here, down south in Lake City, and apparently they do that surgery quite often to remove tumors off the parathyroid gland.
What do you think are some contributing factors that would cause something like that? Was it vaccine related, chemical related, dietary? Obviously there may be some genetic component and things we'll never know, but are there things that we should all be thinking about proactively?
Oh yes, definitely. I would say I would contribute a lot to his condition with hormone and endocrine disruptors. He was kept in a laundry room with, bounce dryer sheets.
Oh, wow.
Don't get me wrong. It was a gorgeous laundry room. I mean, it was huge. It was one of those that you could almost make into a bedroom.
Right.
And that's dog kennels. And so he inhaled on a daily basis things like, their Tide or Gain and bounce dryer sheets and softeners and all of that. And then they had multiple plug-ins throughout the house.
Oh, goodness.
No, because that's what everybody does. Get the Galate plug-ins. And he was constantly bombarded and they had 2 small children, so there was baby powder and things to make everything smell good. And they acquired him as a puppy, so he had been exposed to this for years.
Wow.
Now, I would have to say that was probably a huge contributing factor in his diet.
Mm-hmm.
His diet, the diet that he was on, which no fault of the owner. You know, we're the victims of the best advertising money can buy.
That's right.
He was fed pedigree.
Oh, goodness.
So all those colored pieces in pedigree are full of dye, chemicals, all that kind of stuff.
Right.
And, you know, he's walking on the floor, probably cleaned with Lysol or Mr. Clean, and is absorbed right up through his pads. I would say it was hugely his environment and diet, but like I said, absolute no fault of the owners.
Right. They just didn't know better at the time.
Just didn't know better, and they came into the clinic where I worked. That's how I met them. And every year they'd come in for their, you know, series of vaccines and heartworm tests and fecals. They took excellent care of him.
Mm-hmm.
They if he ever had a problem, they take him right up to the vet.
So I'm assuming with his history, he no longer gets vaccines.
Correct. When I presented on him, we did titer testing on all my dogs.
Right.
And they were all still strong for the core vaccines.
Awesome.
Very strong.
One of the things that comes up a lot when I'm talking to people is, but my vet said, you know, and just like you mentioned, there's another vet that's doing this surgical procedure pretty frequently, which suggests there's a fair amount of dogs who have this problem and who may not be on a natural path, but also that's the go-to protocol versus let's try something natural. So that's a leap for a lot of people, especially when they have the conflict from their vet. So what advice might you give dog mamas who are facing whatever medical issue and how to discuss that with their veterinarian if they don't have access to a holistic one?
It's a fine line. It really is. I was very lucky in the vet that I talked to. His daily care, so to speak, vet, other than the equine vet that I work with, I told him, I said, look, this is what I'm going to do. I appreciate your input, your guidance, and your lab work, but at the end of the day, it's my decision on what I do. And I feel this is the path I need to take, and that's the path I took. Now, I'm going to tell you, it was very hard for me coming out of 25 years of Western medicine not to reach for pred and antibiotics.
Mm-hmm.
Reach for the oils, and if something like that or in a Sereni or something I was used to.
Right.
But it's just one of those things, you know, in your gut. I've always known there was a better way. And when I was in emergency medicine, I was very lucky to work with a veterinarian, Dr. Happy Babish, that was headed down a different road. She was going to learn acupuncture, and she knew acupressure, and she did a lot of the herbs and everything. So I followed her around like a shadow. So I kind of known there was a better way because I had seen the results that she was getting. So this wasn't totally new to me, this concept. Whereas it is with some people, and it's very hard when your vet says, oh, well, he's got infected ears, we're going to put him under anesthesia and we're going to pack them. And then they do that, and then in 6 weeks you're right back to where you were because you didn't detox the liver where the allergens are stored that cause the problem in the ears.
Right.
And holistic vets get that.
Right.
And so you kind of have to change and look, and more vets are becoming a little bit more open to different ways of doing things, and sometimes you just have to find one that will listen and work with you.
Yeah. And I think that's the key, is that we have to meet them with a level of respect, and they need to meet us with the same level of respect. I know before I moved, I felt like I had my veterinarian in my corner. We weren't always doing things that he thought I should be doing, or and I was not doing some things he thought I should. But he could not argue about the health of my dogs. He's like, they're ridiculously healthy. So
Yeah,
yeah,
they can't argue with the results.
exactly.
And it's like at the end of the day, it is still the owner's decision.
Right.
It still is, and I understand it. It's hard. It's like turning the Titanic before it hits the iceberg. But if they'd have rammed the iceberg with the Titanic, it wouldn't have sunk. So you got to kind of take a head-on approach.
Right. That's right. So is there anything else about Little Pocket you want to share with us, or any takeaways that you would like to impart to dog mamas who are just, sort of trying to figure their way forward and into stepping into this natural lifestyle?
Nobody knows your dog like you do. Nobody has that gut feeling about your dog except you. And when you take your dog in and you know there's something wrong and the blood work is still showing normal, stick with your gut feeling. Keep looking, keep searching. We've been finding a lot of toxoplasmosis in dogs on live blood. And so one of the biggest cases that I've run across is a hunting dog. And this dog looked great on the outside, but the owner knew there was something going on. She was aggressive, she would work, but there was something wrong. And all of her blood work came back beautiful. Wow. And they were talking about putting her on behavioral drugs. And the owner was, no, there's something wrong with my dog. And she just happened to walk into our booth at the Houston Dog Show. And I got to talking to her. And she asked me about it. And I said, well, let's start with a raindrop and, a direct blood analysis. And when we did her direct blood, it was so full of bacteria, the dog felt like poo, Right. She felt terrible. And because of that, but the owner she stuck to her guns, and she kept looking and kept looking and kept looking. And so we got the bacteria and everything cleared up in the dog and continued on with her raindrops. And that dog is on her way to a master hunt trial test.
Fantastic.
They don't cancel it this year.
Yeah.
But just stick to your guns. Absolutely stick to your guns. Keep looking. Keep looking for that diagnosis, because lab work only shows what it picks up. A dog has to have 75% of their organ compromised before lab work will show it a lot of times. Mm-hmm. And so when you see that lab work and there's nothing, what do? It says right here, the dog is fine. It's like, no, this dog is not fine. I know my dog, and she's not fine, he or she. So keep looking. Find somebody in the area that does live blood analysis. Find somebody that does the Zyto scan. Find somebody that goes and looks in a different direction, because your dog better than anybody else does. Don't give up.
Awesome.